drug chart of the patient. This is the report that serves as a legal record of the drug administered to a patient at a facility by a healthcare professional. In the monitoring sheet, we can see the following. First, that we can see is the patient's name, the date of birth of the patient, the complete address of the patient, and then in the other side, we can see the physician's name, the contact number of the physician, and then the pharmacy. And then under the monitoring sheet itself, it divides with a certain column with different categories, of course. The first thing that we can see in the monitoring sheet is the date. For example, the date today is November 29. We will be going to write the November 29 on the date, okay? And then next is the medication that we will be giving to the patient. And for example of this is the metformin hydrochloride, okay? And then next, we will be going to record also the dose. For example, the dose of metformin hydrochloride is 500 milligram. And then we will be going to write the 500 milligram. And then next is the time intake, whether it is AM, PM, noon, or bedtime. For example, metformin is taken after breakfast, so it is AM. And then next is the frequency of the drug, for example, if it is once a day, like that. And then the side effects, of course, that is felt by the patient, and by this we can also indicate the remarks in the medication to our patient. And lastly, of course, don't forget to sign or the signature, okay? Indicating that we are the one who administered the medication to the patient.